breast cancer surgery has really improved over the years since I've been there for over three decades in breast surgery. So the types of breast cancer surgery is we have moved from removing the breast, what we call a mastectomy, to now in majority of patients, I would say 80 to 90% of patients, we can just remove the lump, what we call breast conserving surgery. So there's two big lines: conserving surgery, which we do, and mastectomy and reconstruction, which is the other one. So luckily, the majority of patients, as I said, 80 to 90%, compared to 50% 20 years ago. And so 80 to 90% of patients have breast conserving surgery. And more and less patients need to have a mastectomy. So the indication of removing the breast is much less and less. So the most common of this conserving surgery is what we call lumpectomy. So in cancer surgery, you remove the cancer or the lump, or if it's not palpable, you put a special technique to find the area which has a cancer, but especially in screen-detected patients. But basically, you remove the area and you take a rim of breast tissue around it, what we call a margin. So the commonest operation is called a wide local excision. And also for patients who have invasive breast cancer, we check one or two lymph nodes under the armpit called sentinel lymph nodes. But these are the guardian lymph nodes, which I one of the pioneers of sentinel lymph node in the UK, and most of my research was on sentinel lymph node. So the straightforward wide local excision and sentinel lymph node biopsies, as you know, 70% of patients will probably need. So this takes about an hour and a half. And sometimes, obviously, if you use one of the new, which depending on the patient and the lump and the breast, then you can take up to 2 to 3 hours. But majority is about an hour. It's done as a day case under full anesthetic, general anesthetics. They go home the same day. This is one of the myths which I would like to discuss about breast cancer. So, is it more, 90% of our patients will go home the same day case surgery, and they recover after a few days from the surgery. Mastectomy, which is the other operation, obviously takes about, again, an hour and a half. But if you do reconstruction, depending on what type of reconstruction you do, you can do an implant, which reconstruction, or your own tissue, what we call autologous reconstruction. So it depends what operation you have, but roughly we're talking about 3 to 5 hour operation. Unfortunately, with any surgery or any treatment, there is some side effects. My job and the team I work with, what in breast what we call a multidisciplinary team. So multidisciplinary team contains comprises of the whole team: breast care nurses, radiologists, pathologists, oncology doctors, and other surgeons. And this is to formulate a plan and to plan the best treatment for the patient. So the side effects of any surgery start from general anesthetic, and the risk is very minimal nowadays. But my job as a surgeon, which I think is very important, and that's the advances, because we get cure in early breast cancer in more than 90% of patients. So the last thing you need to do is leave them with a deformity, which can last more than the actual cancer and worse than the cancer. So my job is using oncoplastic surgery to minimize the deformity to the patient. And even in some patients, you get a better, like we do a lift up, what we call therapeutic myoplasty, get a better result before you start your cancer surgery. So it's very important to reduce and minimize the deformity, which sometimes in some patients worse than the actual cancer itself. Because as I said, 90% of patients will be cured from the breast cancer. So 90% of patients now go home the same day. The old patients, even mastectomy patients, when you remove the breast, they can go home the same day. And now they can go home with the tube or a drain if you put one. or if you do reconstruction, implant type reconstruction, immediate reconstruction. So majority of patients, more than 90%, you go on the same day. Maximum stay probably one night if he puts a drain and the patient is late in the day doing the surgery. But again, 90% is day case surgery. And then 1 to 3 days, depending on the other kind of surgery. Of course, otherwise I wouldn't be in my job. So, yeah, majority of patients, 99% will, I mean, it depends what you mean by recover. So recover from the surgery itself, as I said, most of the patients are day case, wide local excision, go on the same day, recover from the surgery, and anesthetic a week or 2 weeks. If you have a mastectomy, need a little bit longer recovery and reconstruction. Cure rate for early breast cancer is well documented, and we have achieved a major progress in that, which is well over 90%. Unfortunately, some patients obviously will have a tumor come back. That's our job by keep reviewing the patients regularly up to 5 years to make sure no cancer recurrence. Even if it happens, then we have most advanced medical treatment and surgical treatment. We can deal with that as well. So fewer and fewer patients are dying from breast cancer, which is good news.